Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with kidney and bladder ailments that start with the letter K, Part 1. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, and then issues of infections, infestations in the immune system. Then issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature muir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings, and an account must be taken of the sum total of the person's inherent predispositions and past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with kidney and bladder ailments, starting with the letter K, Part 1. In the average adult, the kidneys filter the total volume of the blood nearly 300 times a day, producing about 1 liter or 2 pints of urine, passed on 4 to 6 occasions. As urine is produced, it filters into collecting ducts in the necks of the kidney and trickles down the uterus into the bladder. As soon as the bladder is half full, its total capacity is about 1 pint. Stretch receptors in its walls signal the urge to urinate. After the age of about 4, the sphincter between the bladder and urethra is under voluntary control. The male urethra, which acts as a passageway for semen as well as urine, is nearly 4 times as long as the female. This, and the fact that its opening at the tip of the penis is well removed from the anus, explains why men are less susceptible to urinary infections than women. Unfortunately, the short female urethra provides bacteria with a relatively swift invasion route to the bladder. Urine, the sterile product of the non-stop filtering activities of the kidneys, is 96% water and 4% organic and inorganic solids, and its color can be a valuable guide not only to the functioning of the kidneys, but also to the state of the liver and gallbladder. The kidneys regulate the amount of water and also the balance of acid and alkaline constituents in the blood. And on these two things all the chemical functions of the body intimately depend. Inside each kidney, the branches of the renal artery subdivide into 1 million or so tiny tufts of blood vessels called glomeruli. Small molecules such as water, salt, various minerals, glucose, and wastes such as urea, which is a byproduct of protein breakdown, squeeze through their walls under pressure and enter 1 million adjacent tubules called nephrons, which selectively reabsorb them. In a healthy kidney, 99% of the water and all the glucose are reabsorbed. This reabsorption process is controlled by hormones made in the pituitary gland at the base of the brain and in the adrenal glands that sit on top of the kidneys. The kidneys themselves produce a number of hormones that help to control blood pressure, stimulate production of red blood cells in the bone marrow, and activate vitamin D. Kidney failure, renal failure. Kidney failure may be acute or chronic, involving a sudden or gradual buildup of water and waste products in the blood. Acute kidney failure means that the kidneys stop working within the space of several hours or days. Cause may be shock, usually due to heavy blood loss or a heart attack, sudden blockage of the ureters, bladder, or urethra. Kidney stones, for example, or more rarely, glomerulonephritis, widespread damage to filtering units in kidneys. Symptoms may be secondary to those of immediate cause, but include scanty urine, loss of appetite, nausea and vomiting, and eventually confusion, abnormal sleepiness or drowsiness, and coma. Orthodox treatment depends on underlying cause. To restore kidney function, the person may need intravenous drip of blood or plasma and diuretic drugs. In more severe cases, several weeks of dialysis may be necessary, or even a kidney transplant. To assist recovery, a high-calorie, low-protein, low-fluid regime is prescribed, together with careful monitoring of potassium and sodium levels. If failure symptoms follow severe blood loss or heart attack, call 911 and give Aconite 30C every 5 minutes for up to 6 doses until help arrives. If the failure sets in for other reasons, the appropriate action is to see a doctor in 12 hours, plus one of the remedies that follow. Specific remedies to be given every hour for up to 10 doses while waiting for help. In early stages of the failure, the person is feverish, anxious, and afraid of dying. Give Aconite 30C. In the early stages of failure, person feverish with flushed face and staring eyes. Use Belladonna 30C. No urine passed or blood only. Use Terbinth 6X. Face and feet look puffy with retained fluid, burning stinging pains in the kidney region. Use Apis 30C. Person drowsy, especially after stroke or heart attack. Use Opium 6C. Symptoms worse for exposure to cold. Use Camphora 6C. In chronic kidney failure brought about by mild but recurrent attacks of inflammation, the kidney efficiency slowly decreases as more and more tissues become scarred. Certain drugs, notably aspirin, paracetamol, and phenacetin, and the toxic trace element cadmium, can also cause inflammation symptoms. Symptoms are insidious: tiredness, feeling lethargic, passing urine more often than usual, and a gradual increase in blood pressure. As time goes on, the person may begin to suffer from anemia, osteomalacia, and hyperparathyroidism, as the metabolism of iron and calcium fails, or may develop the symptoms of end-stage kidney failure. Since kidney damage is irreversible, treatment is directed towards slowing down the failure process. Homeopathic treatment is constitutional and dietary. Although the specific remedies given above for acute kidney failure may be used while treatment is being sought. Orthodox treatment is also dietary, with drugs to control blood pressure and to prevent the bones from losing calcium. Iron, vitamins, and low-protein, high-fluid diet are usually recommended. End-stage kidney failure occurs in 3 out of 4 people already suffering from chronic kidney failure. The last straw, often being a minor urinary infection, symptoms are usually varied: headaches, nausea, and vomiting, oral thrush, halitosis, a furred tongue, diarrhea, retention of fluid in the lungs and under the skin, itchy skin, and cessation of periods. Orthodox treatment is to alleviate as many symptoms as possible by drugs. In suitable cases, dialysis or a kidney transplant may be offered. Homeopathic treatment is constitutional, though until dialysis or a transplant is possible, it can only be palliative. I have a great many videos now on many different topics, and so I decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.